already said, my name is Dr. Christina Vivit. I'm a pelvic floor physical therapist at Women's Advantage. And we are here and happy to have Dr. Adam Sandford talk to us about gut health. So Dr. Sandford, do you want to start off with introducing yourself and giving us a better idea as to why you're here with us today?
Well, sure thing. So I'm a naturopathic physician, and for those of y'all that aren't quite familiar with that is, in the state of California, we're doctors that focus on functional integrative medicine. Many of us have the ability to prescribe pharmaceuticals, and more than anything, it's a philosophy where we work with you to take care of the things that you should have taken care of before we got to the medication picture. It's a whole lot of doing what our grandmothers would have had us do to start. I've been working in the South Bay of Los Angeles, just south of LAX in El Segundo, I think for 7 years now. And over the course of the years, my gut has switched over to predominantly gut focus, along with endocrine, Parkinson's, and testosterone and a couple other areas I just enjoy working with. But overwhelmingly, it's gut focused. And Jenny and crew were just curious to talk about some fun gut things with you guys today, and Christina is going to drive the boat and we'll just go from there.
Okay, very good. All right, so my first question is, how can you tell when something is off with one's gut health?
Well, I typically operate from a perspective of if there's anything strange in your body whatsoever, start with your gut, because you can have symptoms like rheumatoid arthritis, eczema, gumbly gut, diarrhea, constipation, nausea, vomiting. Everything could be related to that because our gut is the primary way that our bodies touch the outside world. A lot of people kind of think of your gut as inside of you, but in reality, that's the main way that we end up by engaging with the outside. The typical things that we think of for gut problems are, upset stomach, IBS, things like that. If you're having, less than 1 to 3 bowel movements a day, depending on your fiber consumption, if your stools don't look well formed, and by well formed, I mean kind of like a snake and brownish. If they're strangely scented, those might be all signs that your gut's having a few problems here and there. Gas and burping should be fairly minimal. Not everybody realizes that having a whole ton of gas or a whole ton of burping isn't actually normal. And then kind of anything outside of those areas, we definitely, ponder if there's something going on with our guts.
Very good. So in terms of poop frequency, would you say that we should be shooting for at least once a day? Because I know some people can classify constipation as if you haven't gone in the past 3 days, that's considered as constipation. But then others will say, oh my gosh, you haven't gone in 3 days. Is there something going on? So in terms of frequency, what is your take on how frequent we should be going?
So yeah, from the clinical conventional doctor perspective of constipation, it's every 3 days or more. I typically think from a functional perspective about when everything is running really well, how often you're going. And that's that 1 to 3 times a day. A vegan's going to be going a whole lot. A non-vegan's going to be going a little less just because of the extent of what's consumed. But if you're going less than daily, oftentimes there's some kind of a slowdown in your tract someplace, or you just don't eat that much, or you take laxatives and have spaces between your bowel movements because of the laxatives.
Got it. Okay. And in terms of people who are more at risk for gut health issues, can you share a little bit more as to who would be more at risk?
Yeah, all of us. Again, since I'm a gut doctor, it seems like everybody on earth has gut problems. It can go all the way back to birth. If you were C-section or weren't breastfed, you missed out on key portions in time where your body was getting its immune system and its initial bacteria. If you had strep throat as a kid, a whole bunch, and had a whole bunch of antibiotics, then your gut bacteria picture changed a whole ton. If people don't have a lot of soluble fiber, if they're eating, a nonstop Atkins diet, or if they just prefer not to eat plants, that could be an issue. History of food poisoning, And anxiety is actually in there. If you have a high anxiety level, that can drive kind of that diarrhea picture of IBS. Unfortunately, though, a lot of doctors, if somebody has a GI problem that they can't figure out, will say that it's all in your head. And I can tell you categorically it's not. If a doctor says that your GI problem is all in your head, you just need to say thank you and maybe find the next good doctor that'll listen to you. Other things that can lead to risk are a history of eating disorders. Typically, classically, when you're talking about IBS and gut problems, they kind of say it's women between the age of 35 and 55, but it's all over the map. I see pretty much everybody. So I don't think there's a particular gender or age range that's associated with the risks.
So you're mentioning IBS quite a bit. Can you explain a little bit more as to what IBS is? So just we can clarify so that we can all be on the same page here.
Yeah. If I recall properly, the current definition of IBS from the Rome 4 criteria, who's he, what's it thing, is basically abnormal bowel movements more than 3 or 4 times a week for more than a few times per month that impacts daily living. In reality, anytime that a doctor says you have IBS, it's probably because they can't figure out what's going on from a conventional model. If you don't have celiac disease or an ulcer, Crohn's, ulcerative colitis, but you still have problems in there, it's just kind of everything's lumped together as IBS as a definition. In the last 10 or 15 years, we've started to get a better definition of IBS. Now it's looking like 50 to 55% of people with that IBS diagnosis actually have a thing called small intestine bacterial overgrowth, or SIBO. Dr. Mark Pimentel out of Cedars has been doing just amazing work in this and has really helped turn the corner for how we end up treating and looking at IBS. So for me, how I would diagnose a SIBO IBS type of picture, if we were just kind of talking to each other, is if you have any problems at all within 2 hours of eating, if the problems seem to happen a lot with certain types of food, but not with other types of food. Yep, and there's questions in the chat. Turn that off.
Oh, that was from Jenny.
That's just fine. And I guess also the symptoms can range. It doesn't just have to be nausea, vomiting, diarrhea, constipation, things like that. Like I was saying, skin rashes, brain fog, restless leg syndrome, all can tie back to SIBO and IBS. Stephen thought that Parkinson's has an original insult with IBS and SIBO. So that's kind of that picture.
Very interesting. And we'll talk a little bit more about the management of those two a little later in this conversation. But this one goes into what we were just talking about. What are some of the most common gut health issues that you typically see in the office?
Sure. Well, like I was saying, that SIBO is by far and large the most common. What were the numbers I looked up? Something like 15 or 20% of the American populace, so 35 million or some such, have IBS, and more than half of those are SIBO. It's massive. Linda had just asked what kind of testing is used to determine if SIBO is in place, and the best test that we have right now is called a lactulose hydrogen and methane breath test, where you basically sit around for 3 hours in your house or at Cedars and blow into a tube. And that gives us an idea of where the bacteria seem like they're living. Circling back to your question again, what was it? I wanted to answer it while it was there.
Yeah. My question was, what are some of the most common gut health issues that you typically see in the office?
Yeah, so it's SIBO, and then as part of that, it can be constipation, pain, reflux, like silent reflux, people that have a raspy throat, or sinus congestion, it could be silent reflux. I just even thinking back through today, I had somebody come in with silent reflux, another person with, anytime they bent over, they had stabbing pain. I had a kid with Crohn's. So runs across the board, but the most common is just where people talk about, I'm uncomfortable, and it has to do with my stomach or food.
Got it. Um, we have another question here. Is the short breath test reliable or no?
I think you might be asking about the spot breath test, where people just do a single tube when they're assessing for methane. In my clinical experience, no, because all that's going to give you is a single point in time. They use it to assess for methane overgrowth because typically you shouldn't have a methane overgrowth. But if you just do it randomly and it's not associated with the time that you ate food, we don't know if that's small intestine overgrowth or large intestine overgrowth. So it tells me that methane's weird, but it doesn't tell me where it is. So it doesn't give me any data on SIBO.
Very good. Okay. So let's zoom out of the IBS and SIBO bubble for a little bit, and let's just talk about constipation management. So
Okay, yeah.
what are some of your favorite tips or tricks to suggest to just whoever's on the call right now of how to manage constipation?
That's a good one, isn't it? I guess that's the other huge thing that people come in for. Let's say they don't come in for it. They take everything over the counter, and then after years and years, they come in for it. So if we think about constipation, we're thinking about kind of the volume that comes out, how hard it is to get out, whether you feel completely emptied, or then the frequency and how many days, things like that. I kind of break it down into 3 primary variables or more. I don't know, we'll see as we keep talking. There's low water. If people aren't taking in 60 to 100 ounces, depending on your body size and exercise level per day, there's a very good chance that your body itself is dehydrated, in which case there's very little water for your stools to use to remain soft and get out. So that hydration would just be absolutely the first thing to do. Other times it could be an issue with insufficient mass. So if your muscles are trying to squeeze things out, but there's not a whole ton going on. So if you eat a whole bunch of meat or protein where there's just not enough, they don't bulk up very much, then it's much harder to pass those things. So that's where things like psyllium husk, sun fiber, I'm a huge fan of if it doesn't bother a person. Beans, lentils, any of those things your grandmother or the American Heart Association told you to take for eating fiber would be great. And the third area is poor gut muscle movement. This happens with SIBO, where SIBO paralyzes the squeegee muscles in the gut. It also just happens as we get older, if we don't have enough stomach acid to trigger the movement cascade. That's a more tricky one. That one, there might be digestive enzymes you use, maybe some products that contain senna or aloe can be a little helpful. That's like, I think X-Lax is a senicide, that type of thing. Those, you don't want to use those super often though, because your body can become a little overly adapted to them. If you're dealing with that one, if the mass and the water aren't really starting to move it, then chatting with somebody like me, or a smart GI doctor or a smart primary would be a good idea. Some other things that I've written down, we were talking about this before. You can increase the water that's in your gut by taking magnesium. So everybody's heard about taking magnesium for bowel movements. That's how the magnesium works, is it pulls water into the gut so it'll move. Miralax does that too, but I'd rather start with magnesium. And then there's this weird one that people hear about from the medical medium. I've got nothing to say about how he got the data, but there are a few things that are pretty cool that come out of it, which is a celery juice thing. If it doesn't tear a person up, like causing GI upset, celery juice really kind of does a good job of getting people's guts moving, and actually for a longer term fix. So I think it's something like 16 to 32 ounces of celery juice per day. It takes a couple of weeks to get things going.
Celery juice, how do you make that? You just grind up celery and water?
You could put it in a blender. I've never tried that. A juicer, it would be the thing to use. I have a fancy Breville one that's easy to clean. Or just go to your local juice place. This is Los Angeles. There's like one every 3.5 feet.
That's right. Okay. Interesting. Looks like we have a few questions here. Would you want to answer these
Yeah,
questions right
sure.
now?
I can just start at the top, and we can go up and down, unless you think that's a bad use of time. But what would you like to see us do?
Yeah, you can just briefly go through each of
Okay,
the questions. Sure.
sure. I'm okay. It's succinct when I'm not babbling. So if your stomach swells up and is hard at night, and you look pregnant at night, and it's progressive through the day, then I would be thinking it is a small intestine bacterial overgrowth thing, especially if you're running vegan, as you mentioned. Veganism has a whole bunch of fermentable carbs. If you're eating carbs that your body's not a huge fan, or your bacteria is not a huge fan of, that bloating is progressive. And the thing to do there would be start out by taking some kind of vegan focused digestive enzymes. I think Integrated Therapeutics makes Similase V or some such, or Ortho makes one. And then also maybe get assessed for SIBO. Sean had a question about recent diagnosis and then treatment with Xifaxan and Flagyl. So there's a big thing about SIBO. So again, SIBO is an inappropriate overgrowth of bacteria in the small intestine. And the treatments for SIBO are either to kill bacteria or to starve bacteria or to do all some other things that I do that we might talk about later. The SIBO diets are super restrictive because you're not feeding your body the foods that the bacteria like. So that's all the fiber I was talking about. These are really difficult diets to follow and super annoying. The question was, do I have to stay on it forever? The idea is to utilize the diet to control your symptoms, and then to pretty much rapidly start adding foods back in as quickly as you can while working with your doctor, while tracking your progress using the breath tests or this other cool thing, which I'll talk about in a second if we have time. As for timing with SIBO, that's really, really hard to tell. It depends on what your initial breath tests were. The biggest thing to remember with SIBO that most doctors won't tell you is that it is oftentimes a chronic condition where we do all this great treatment, we make the symptoms go away, but oftentimes they will just come back, ebb and flow. And the name of the game sometimes is just helping you identify what the symptoms look like when they're just barely starting to raise their head, and then slapping them down with some herbs. So you'll never be in the same place that you were when you first sought help, but you do need to be vigilant about finding out what foods or what not annoy your body. Jenny had asked what the difference between sun fiber and straight psyllium husk is. Sun fiber is a fancy processed version of guar gum. Don't correlate guar gum with the SIBO diets. They're not, this thing and that aren't the same. Sun fiber is fermentable and feeds your happy bacteria in your large intestine, which in a lot of cases does a glorious job in changing your bacterial balance and helping fix constipation, helping fix bloating and stuff that happens in the morning or continues through the day. I think I had asked that question earlier. That could be another part, is a large intestine. Kathy asked a question about, yes, coffee, weirdly enough, does a great job with helping people have bowel movements. Sometimes it's the size of the volume of the drinking or just the caffeine. A lot of people love it. I have heard that. I haven't really, with antidepressants, they do impact the metabolism of serotonin in the gut. And serotonin is one of your main neurotransmitters that helps your gut squeeze things along. So sometimes antidepressants can negatively affect gut mobility. For a balance between soluble fiber and insoluble fiber, I actually don't have a good ratio for you on that. I just spend most of my time telling people to eat more of it because both are important. Soluble fiber, your bacteria eat. Insoluble fiber just creates a lot of good bulking.
Can you talk a little bit more about what are examples of soluble fiber versus insoluble fiber?
Oh, like the stringy stuff in greens is a lot of insoluble fiber. The stuff in beans is a mix of soluble fiber and insoluble fiber. Grains and breads and stuff like that is like the chaff on a grain, you know, the stuff that makes brown rice brown, that's going to be insoluble most of the time. And then the other starches wrapping the rice are more soluble. Yeah, I'd have to bring in my nutritionist to really drill into that for you, because I actually just prescribe a lot of the concepts and then the supplements and pills and a little bit of dietary focus, and then she really carries the ball for that. The name of the test for SIBO, it's a lactulose, LACTULOSE, hydrogen and methane breath test. And they do it at Cedars. If you're going to go see me, don't go to Cedars because they only run the test for 2 hours, and I find that not useful. If you're going to see anybody else, that Cedars test is fine. And then I have to use one through a company called Aero Diagnostics, where you just do it at home and mail it back. And then the last, best type of magnesium. For having a bowel movement, Trader Joe's magnesium is great because it's cheap and of very poor quality. So your body's not going to absorb any of it, and it's just going to help you eliminate. So magnesium oxide, magnesium carbonate, a little bit of magnesium citrate. Those are the ones
for people with SIBO too?
Usually, there are some people with strange gut bacteria where the magnesium can be upsetting, but that's rare.
Okay.
Maybe like 1 out of 20. And then there's a question about 4th generation IBS. That is a long conversation about it being hereditary or not. Because you have like the historical anxiety that can run in the family. You can have the area that a person grew up in with endemic food poisoning. Like if you grew up in, Latin America or something like that, that would be more of a broader question. And so I think we're caught up on the questions there.
I think you actually missed one. There was one, would you mind briefly discussing leaky gut and H. pylori, please?
So H. pylori is a little bacteria-like critter that lives in the lining of the stomach. And we'll talk about the locations of the body parts in a little bit. But it was the thing that I got a Nobel Prize for, not too long ago, for discovering that that's what caused ulcers, not stress or anxiety. It's H. pylori. So it's a bacteria that lives in your stomach, lowers your stomach acid, and through the lowering of your stomach acid can cause discomfort, reflux, poor digestion, lots of stuff. There's another breath test for that, or a stool test, or a mediocre blood test. The other question was about leaky gut, which is not directly correlated with H. pylori. Leaky gut is when you have the really tight lining of your stomach. So you have the big tube of your stomach, right? Then you have the cells that line up that keep things from crossing over into your body unless they want to pull them in. All leaky gut means is that those tight linings aren't so tight anymore. They let food particles or bacteria particles or whatever cross over into your body in a structure that your body is not expecting. Your body is used to taking food, breaking it down to teeny weeny pieces, and taking those specific teeny pieces in. But if you get a particle of a cheeseburger in, your immune system is going to mount a response. And so the symptoms of leaky gut are like brain fog, skin stuff. There's the oodles and oodles. If you Google leaky gut symptoms, you get hundreds. In my opinion, leaky gut is a secondary effect of having a bacterial or a yeast or a parasitic overgrowth, where those overgrowths are annoying the tissue, causing the leaky gut, or if a person's eating foods that just annoy their bodies in general, where they have a food sensitivity. So I view leaky gut as a side effect of some upstream problem.
Okay. Very good. So I think the next few questions, I have a couple here on the IBS and SIBO, but you pretty much answered a lot of those. But one thing that we didn't talk about yet is food allergies. So I think we covered a lot on IBS and SIBO in terms of what those look like, but in terms of that versus food allergies, can you share a little bit more about that?
Sure. Again, my old techie brain, I was in Microsoft for a million years before this, so I still break things down into flowcharts in my brain. We're talking about food allergies. We're talking about when you eat something, you have a reaction. So one of those reactions your bacteria or your candida yeast stuff or a parasite don't like it. So that's where some other critter that's not you doesn't like the stuff. And then the metabolic byproducts of that could be affecting your body. You could have a straight up food allergy, which would be the kind of thing that might make your nose run immediately, or your lips tingle, your eyes tingle, give you hives, things like that. Those are allergies using this one particular allergy part of your immune system. If Benadryl fixes it, it's an allergy. You can have food intolerances. So that's like people that are lactose intolerant. They don't have an allergy or anything to it, maybe. They just have the inability to properly break the food down. And so the food doesn't treat them well. So that would be an intolerance. And then you get to sensitivities, which is where there's a million tests for it. And that's where your immune system, that's not your allergy immune system, your other part of your immune system, recognizes the food as bad. And then your immune system throws a fit and kicks up a whole bunch of inflammatory chemicals and things like that. So 4 or 5 pathways when you can think of about food allergies and sensitivities. For the allergies, conventional medicine has tons of great tests. They're pretty cut and dry. For the bacterial types of allergies, that's usually done through an elimination type of diet. There's no solid test for specific foods with that. We could tell you with the breath test if you're going to have problems with like fermentable carbohydrates or things like that. Then with the sensitivities, with the other immune system type of reactions, there's dozens of tests, dozens of all varying qualities and technologies and things like that. That's pretty much my question for that. I guess Linda asked if there's an actual test for leaky gut. There's a mannitol lactulose test, I think, where you drink some stuff where the molecule shouldn't cross into the body, and then you collect your urine. If it's in your urine, then it did cross into the body. That's an old school naturopathic test. I don't really use it. I just assume that anybody that has any symptoms in their bodies that has to do with food, leaky gut's a component of it, because it pretty much always is. And do I treat diverticulitis flares? An active flare that is with a fever and possible ER visit, yeah, I treat it with antibiotics, as one should. But if you're just kind of flare, if a person has diverticulitis flares, but you're not in a hardcore major one, yeah, it's a lot of microbiome rebalance, fiber, lactulose, sun fiber, maybe mesalamine or the other calming drugs. And that's it for that.
Very good. Okay. How is the gut connected to our immune system and brain health?
Oh, yeah. So you guys have all heard how like X% of our serotonin is in our gut. That's so it can make things squeeze. Well, also a huge portion of
what serotonin is.
Oh, serotonin is a neurotransmitter that lives in your brain and in your body that's related a lot to depression, happiness, and mood outlook when it's in your brain. When it's in your stomach, it's one of the main communication signals. Just think about electricity on a phone line, I guess, where it's helping to communicate between the cells. And it's a big one that's used by the nervous system in the gut, cells in the gut to squeeze things along. For the immune system, it's kind of a similar thing. If y'all remember a little while ago, I mentioned how the gut is the primary way that our body touches the outside universe, because we have so much surface area. The outside of my body, I don't know, like the size of a couch. But your stomach, if you laid it out flat, all the surface area is half a football field. Just think about that. Your innards are touching half a football field size of the universe, which means we have to have a whole lot of protection inside our guts to keep nasty chemicals out, to keep evil bugs out, to make sure that we're sniffing and balancing things. So your immune system is trained, and it does a lot of its learning based on what it experiences in the gut. Then you're asking about how that kind of ties back into the brain. When you have any of those conditions or symptoms where you have a grumbly gut or constipation, diarrhea, etc., that is bacteria or yeast mediated, those critters are making chemicals that cross through your gut, whether there's leaky gut or not, into your body. And those chemicals can circulate up into your brain. If you want to Google it, the word to Google is endotoxin. And you can, there's a website, scholar.google.com, if you love studies. Just punch in endotoxin and depression, or endotoxin and, I don't know, Parkinson's, and you'll get gobs of studies. There's a lot of tight correlation between this stuff from the bacteria in your gut that goes up and can drive anxiety, depression, brain fog, rheumatoid arthritis, there's some multiple sclerosis. I don't talk too tightly about that. But also, like, a food sensitivity can drive it too. If I eat almonds or eggs, my IQ drops by 80 points within 20 minutes. I don't know what's happening inside my gut. I've looked for it. It's just clear. Those two things, my body has a negative reaction to, and it directly affects my brain. So,
are there certain foods that we should be avoiding that cause that reaction in the general population?
It's going to depend on every person. If you have the grumbly gut things within an hour or two of eating, Narala Jacobi, last name is Jacobi, has a fantastic SIBO learning course up there, but she has a thing that she calls her biphasic diet. If a person's eating food and having problems and they think that it might be due to the foods and bacteria, if you eat according to her crazy strict diet for a week and you notice massive improvements, that's good data. Now, please don't go eat according to that diet till the end of time. You will hate me and wish you'd never watched this. It's just a quick way to do an assessment. Key foods to avoid. The biggest thing is, if the food is beige, it's probably been highly processed. That means that bad stuff that's in the plants has been heavily concentrated. Good things that are in the plants have probably been destroyed through the processing process. And they're more likely to spike your blood sugar, cause diabetes, and things like that. So by beige foods, I mean anything that's that color. Crackers, chips, pasta, bread, anything that's grainy, or tortillas, that people tend to eat in excess. Oftentimes we eat them in excess. I mean, they're fine in a little bit, but the amount that Americans tend to eat them, it keeps me employed, but it doesn't really do good things for everybody else. And soy protein, just avoid soy protein unless you're a vegan and you really can't find another way to get it in.
So what's soy protein, like tofu?
Tofu's a little better. I'm thinking more texturized vegetable protein, the stuff that gives the protein count on a lot of like Cliff Bars or breakfast cereals or anything you get at Andrew Weil's restaurant. I have a personal vendetta against soy. Ladies with soy that's not soy protein isolate, it's actually a good thing. Those phytoestrogens can do a great thing, especially when you're kind of going through the transition.
Okay. My next question is, what is the big deal about fermented foods?
Oh, yeah. Those have really been kicking off lately. There's a guy named Sandor Katz who wrote some awesome books on it. So fermented foods are kind of a staple of a lot of different cultures going back over the years. For the Japanese, you have the fermented ginger. For Korean, you have kimchi. Even Germans with sauerkraut, kefir for a lot of different areas. So all of these foods kind of take the basic food and they integrate whatever the local bacteria and yeast are, and they ferment. So they become, they have that special twang that sauerkraut does. And what they add to us are they give our body a whole bunch of extra bacteria, not necessarily that are going to colonize our guts, but that help signal our immune system to do the right thing, that help create these little fatty acids that help feed all of our happy bacteria. And they're just if a person tolerates them well and doesn't have any major histamine issues, fermented foods can really be healthy for a person. And they're quite tasty.
Good. Okay. Another hot topic that I want to talk about is probiotics. Can you share a little bit more about probiotics, and does one size fit all?
Yeah. So probiotic is really just a bacteria that either is a type that already lives in your body or that has hopefully been studied to cause beneficial effects in your body. A prebiotic feeds your internal bacteria, or as Saccharomyces boulardii, people cross those two. There's not really a one size fits all probiotic that'll cover every condition out there. But things like Culturelle that you can get at Costco, it's actually pretty good. The Lactobacillus GG is a pretty well studied strain. I'll usually use probiotics by the company Claire, Klaire. Don't get them on Amazon. Well, if you can get to the Claire actual store, get them on Amazon, but don't just buy it from any random vendor on Amazon. And there's 5 or 6 up there. If you're not sure what to get, their Vital 10 is nice and inexpensive, and pretty lightweight, pretty good, pretty general. They have one Therabiotic Complete, which has pretty good coverage, and they're useful tools. Again, they're not necessarily colonizing your gut with those bacteria. The bacteria are just going in and stimulating the environment to where happy bacteria can more readily flourish and cranky bacteria can be outcompeted by the happy ones. Most of the time when you take probiotic pills, they're out of your body within a couple of weeks.
Good. Okay. And for the healthy adult, what are some daily supplements that you recommend for gut health and immune health?
Okay. Well, we'd mentioned the sun fiber before. That's really good stuff as just kind of an easy additional fermentable fiber that predominantly feeds happy bacteria. I guess that's a lot of times a starting place for me if somebody's just working on it. If you want to not use something that has a long name like partially hydrolyzed guar gum, you can also use acacia fiber. That's all over the place. Now brand makes a nice one, or actually Heather's tummy fiber tastes better. That's another great fiber that can help balance out your happy gut bacteria. Any type of food that's a resistant starch food, and I'll find the link for you, but Alan Christensen made a great blog that has 40 different resistant starch foods. Those also feed happy gut bacteria. If somebody's having a lot of, I guess we're not talking about the people with problems, we're talking about just kind of general benefits. Vitamin D is critical. Almost everybody that I come across is deficient in vitamin D, and I've measured thousands of people. The only people that have normal vitamin D are ones that just came to the country from someplace else and have not been drinking the water in Los Angeles. Like, seriously, it's that significant. Making sure that your iron levels are good. Typically, a guy's iron levels, or a lady that has gone through the change is postmenopausal, are going to have okay iron levels. Women of childbearing years, usually iron's low, and so immune system's typically going to suffer from that. Omega oils are also pretty important for the immune system. If someone's running really super stressed, a B complex is a really good thing. I like Pure Encapsulation's B6 complex. If you have methylation issues, don't take it. If you don't know what that is, get a lighter weight one. And then magnesium glycinate can be fantastic if you're running stress. So like a B vitamin, like a fancy B complex in the morning, and then a magnesium glycinate, specifically magnesium glycinate at bedtime, really can help you turn the corner on stress. Sleep. Your body's not going to repair. You're not going to have a strong immune system unless you're getting normally 8 hours of sleep while it's dark outside. And if you just use those 2 variables, that'll help you figure out what hours to sleep. And after all that stuff is when I talk about kind of specific supplements for any given individual. That that answer the question? Any?
Mm-hmm. You
Yeah.
know, you mentioned something about water quality, and just out of curiosity, can you share a little bit more about the tap water versus other type? I know there's all sorts of fancy waters out there. Do you have
Yeah.
any words about that and gut health?
So I don't have the big reverse osmosis thingy in my house or anything like that. I just have a really good high quality regular water filter, predominantly because I want to get some of the organic chemicals out, and because water in the South Bay sometimes tastes gross. But
Is it as dirty as it tastes gross, or
if it tastes gross, it's definitely got some funkiness in
okay?
it. Yeah. And removes a lot of the chlorine. I forget the company that I'm using. I did a lot of research. I'll find it for you guys, and you can let
Okay.
folks know. Uh, Now, if people really, really want the cleanest water, that's going to be reverse osmosis. They just need to make sure that they get their electrolytes in, because our typical water that we consume has decent electrolytes in it. And if you only consume reverse osmosis, you're missing some. I'm not a huge fan of water out of prepackaged plastic bottles. Who knows how long it's been in there? Who knows how long that squishy, leaky plastic has been getting into the water? It just remember, our bodies are more than 50% water. If the quality of the water that we're taking in isn't that hot, we're just dumping stuff into us. So if you have little simple decisions you can make in life, nice filtered water, metal water bottles or glass water bottles, getting rid of the plastic squeezy ones. Well, those are easy, simple questions.
Very good. Do you want to answer some of the questions on the side before we move on? I know we're almost short of time here, so you can go ahead and answer some of those if you'd like.
I can take a look at a quick couple. How does it happen that people get so backed up that they would need surgery for obstruction? If somebody's so backed up that they have an obstruction, there's either a significant amount of scar tissue that's going on. Maybe somebody had a C-section, a sling or something like that. For those, definitely talking with everybody at the clinic, at y'all's clinic, would be a thing to do, because if it's just scar tissue that's preventing the mobility, that's critical. If they had a bowel resection, so the nerves are cut, that's critical. But most of the time, if somebody's that backed up, all the things we talked about before, plus probably a pharmaceutical for maintaining proper gut motility. The one that I would use is Motegrity, also known as precalopride, would be the thing. This is near and dear to my heart. My mom has chronic obstructions. Cause of occasional fecal incontinence. It could be rectal tone. Again, hanging out with y'all's clinic would definitely be a thing to look at. Could be increased pressure in the abdomen due to excess gas from bacteria, things like that. And I'm sure that you guys can speak much more about incontinence if that's not a big thing that I end up treating, unless it's a side effect of the others. I guess poor pelvic floor strength would be one of the things you talk about, right?
Yeah, poor pelvic floor strength can be a cause. What can also be a cause is not only poor pelvic floor strength, but also seeing impairments in coordination. So whenever there's increased pressure downward, we want to make sure that those pelvic floor muscles, in conjunction with other muscles in your body, are able to provide that counterforce in order to prevent you from either leaking or passing gas when we're having a pressure increase downward. So it can be also a coordination issue where those muscles might not be able to provide that counterforce as a response to a pressure increase as adequately as needed. But we can talk about fecal incontinence all day.
That
So
makes sense.
I'll let you
And
move on to the next questions.
that made me remember also, as estrogen lowers, as you're approaching menopause or going through menopause, that also changes the muscle tone in the area. I've seen a lot of improvements that with both fecal and urinary incontinence. Optimal vitamin D levels for myself in my practice, that's between 60 and 80 on the range. Typically now conventional medicine range, anything less than 30 is deficient. It used to be anything less than 20. For me, it's 60 to 80. Negative aspects of soy. Again, that's a little bit of a personal vendetta. So don't take that with a huge grain of truth. But the soy protein, your gut bacteria really was not designed to deal with. And I see that have consistent effects with people. Regular tofu, tempeh, oh, there's another fermented food. Tempeh is fermented, I think. Those aren't quite as bad. When we're talking about a lot of the primary things that annoy people's food sensitivities, like we talked about, or even the bacterial type, it's the foods that are most commonly abused in our diets, which is soy, corn, wheat, almonds, dairy. I think one other one I'm missing. A lot of times people have just built up a sensitivity to one of these primary calorie sources that we have in our diets. Jeanette's asking about ELISA. Okay. If a person has done an IgG, so that's one of the food sensitivity tests that I was talking about earlier, panel, and everything is turned up, there's no way that you're allergic to all of those different foods. Generally, what it means is that your overall immune system is turned up, and that certain things are absolutely true flares and others are just kind of static. Like when you're changing the radio, back when we had radios, and you'd hear static and then you'd get a station, then static. When everything's turned up, the lower level ones are static. The question about what happens if I eat those foods occasionally, the best way to figure out, well, the thing to realize is that none of these tests should be taken as gospel at all, ever. Food allergy tests are just a useful guideline to help you identify a subset of foods to try pulling out of your diet for a month, and then personally trying them yourself at a relatively high dose to check and see how they are. And that's really the only way I use food sensitivity tests. Otherwise, people end up doing way too much restriction out of their diets for foods that might annoy your immune system a little bit, but ultimately don't impact your symptomatology at all. And do I have time to talk about that little black tool that I brought? Oh, this will be a real quick talk because you had other questions for me. This is the Food Marble device, foodmarble.com. I've been chatting with their chief science officer. They're pretty cool. This is basically a hydrogen-only SIBO breath test. So if a person does not have a methane or hydrogen sulfide-based type of SIBO, which is a totally different conversation, this thing is really useful for gauging how much a specific food might annoy your body. And if you want to go read about that, just go to foodmarble.com. It's pretty neat. I'm working with the company to make it more clinically relevant for my folks, but I enjoy working with it. I think that caught us up on the questions there. What else do you have, Christina?
Does anyone else have any questions before I move on to my wrap-up questions? Let's see. We'll give it a few seconds and see.
So typically, this is a direct-to-consumer device. They've been selling it on the market. I think I got the first Kickstarter one 3 years ago. So they've been selling it for a while. They're doing trials with myself, with a couple of NHS hospitals in England, and I think Johns Hopkins, for working with clinicians directly. I am starting to evaluate results from this with my patients, but it's not fully integrated into the practice yet. We're still kind of working it out. But for you working with it at home, to seeing how well hydrogen SIBO-based food reactions impact with you, it can be a great tool. Just encourage everybody to go read about it. It's pretty neat. If it seems like it fits you, it's worth the time. And there's a discount coupon. I think if you type in DRSF15, that gets you 15% off. They made that for me a while back. DRSF15. There
you go. So, in terms of where to find you, and if someone does want to find you, what would be the first office visit format? What do you typically do when you take new patients? So
Okay.
let's start off with where to find you.
Sure. Well, my physical clinic is in El Segundo. If you'll know where that is, if it's basically the 405 and 105, kind of down to the left a little bit. And I'm not actually, since the pandemic, I'm not there too horribly often. I do most work via Zoom because most of the stuff we do is clinical and lab tests. There's also 3 other great doctors that work there as well, if you're looking for a female doctor. While I do a whole lot of gut, Dr. Danielle does a lot of women's health. And I think she partners with you guys a lot on that. She does PAPs with women's health, hormones, things like that. And Dr. McLean does a whole ton of kind of mental, emotional, neurological health. It's a pretty well-rounded group. You can find, well, my website that's under development at docsandford.com, but you can find the whole team at NA, like Nancy Apple, nawellness.com. And you can check it out, have some fun with that. Way a visit might go is we get together. I reserve 90 minutes for us to really have a conversation so I can hear everything that's been going on. You and I will take a look and see what common threads are going on. Maybe you have a skin rash and a gut thing and no hair stuff and a thyroid thing. And we just look at all the ways that they kind of intertwine together, figure out the areas that you want to work on first, or we kind of negotiate what I think is really important and what you really want to work on. And come up with a plan, figure out whatever testing is necessary. We'll get together again 2, 3, 4 weeks later, depending on what we came up with, assess the lab results, assess how things went, and just kind of go from there. And every condition, every visit's a little different. But that's normally the flow. We meet, we talk, we test, I listen, you do stuff, we reassess, we adjust.
Very good. All right. So in terms of big takeaways, what are some things that people can do now to create change in gut health? Top 3.
Okay. My favorite, because it's fun to say, is try to eat the rainbow of colors of vegetables every day. You're going to get tired of purple after a while. And try to eat 30 or more different types of plants per week. Your gut bacteria and your body view the different colors of the plants as a different type of core sustenance. Like you've got one type of gut bacteria that just loves cranberries. I'm serious. It's Akkermansia, anything with a red, thick skin. Eating 30 different types of plants means that you're getting in a wide variety of different types of fibers and micronutrients. So you're just keeping in that idea of 30 different types of plants and eating the rainbow, you can ignore most other dietary advice, honestly, because you're going to get all your fiber that way. You're going to get your micronutrients that way. You're going to crowd the beige food out of your diet because you're going to spend so much time eating good plants. It works out really well. Water, again, your body's 50, 60% water. If you don't have enough of it, nothing works right. And then just if we're just talking about the gut health optimization, just working on making sure that your digestion is optimized. And that's going to be like, well, because now I'm going to go into a whole other rat hole. So let's just say eat the vegetables, drink the water, and get in some kind of happy, healthy bacteria into your diet. So through the fermented foods, the kefir, the kimchi, the whatever, or a probiotic, that'll all help balance things out for you if you don't have kind of crazy SIBO or something like that.
How important is movement as a part of gut health?
So one of the most important parts of SIBO and IBS is the gut motility, so the rate at which things get moved out of your guts. And exercise is critical for that. If a person isn't getting enough physical body movement, their guts are not emptying themselves out quick enough. If that happens, not only constipation, but you have a chance for bacteria to just pool up and create an overgrowth. So Yeah, thank you. Exercise is just phenomenal. And it really should be in that top 3. That's more important than drinking kefir.
Great. It looks like we have another question. Does poor gut health also affect blood pressure and cholesterol and weight gain?
Yes. With weight gain, there's a lot of jerk bacteria that can cause weight gain either through their directly creating calories from eating carbs in the wrong way, or through dumping out certain chemicals. Cholesterol, there's certain bacteria that also can increase cholesterol. That's been my experience. But it looks like we've hit our time, and I just want to thank you for having me and get this opportunity to answer some of these questions. It's been fun.
Yes, thank you for coming on to our interview. We're so happy to have you. And like Jenny said in the chat, you can find our talk on the Facebook page as well as our Instagram, and you can rewatch it anytime.
Nice.
And I just wanted to lastly say thank you again. And if you want to come hang out with our therapists, a little more live chatting, the first Wednesday of every month and the last Wednesday of every month, we get on and talk about our monthly topic. So 2 of our staff members are on live. And so the first Wednesday of the month, we go over some recent research about whatever our topic is, this month obviously being gut health. And then the last Wednesday of the month, it's a open forum Q&A. If we had missed any questions in here, we would go over those, or we just go over the most common clinical questions we are getting from patients in the office about that particular topic. So feel free to hop on and throw questions in there for us, and we would love to answer those live.
And Jenny, is this also going to be on our YouTube channel too?
Yes.
Okay.
Yep, so we can find any of our monthly interviews that we have been doing since July are now all posted up on our YouTube channel, which is Women's Advantage Physical Therapy. And this one will be up there in the next day or 2.
Nice.
Very good. All right. Thanks everyone for joining. I hope you all learned a lot. I know I did. So thank you, Dr. Sandford. We appreciate it so much.
Absolutely. I'll see you guys soon.
All right. You
Thank
take
you.
care. Bye, everyone.
Bye.